All right, good evening. Welcome to this year's Creativity Masterclass. It is a great pleasure to have Eleftheria Darli here with us. Eleftheria is the head of clinical operations at Novo Nordisk, Greece. I'm very happy for different reasons. Over the years, the last 6 years, we've been having this institution of Creativity Masterclasses. We've had people who came from different industries, the arts, winemaking, the banking sector, filmmaking, marketing. We never had before someone from the pharmaceutical industry, so it's always a great pleasure to have someone who is going to talk to us about creativity and creative careers in that field. It is also my pleasure because Eleftheria has worked in very large and established companies, in small companies that, at least at that time, were starting up, in multinationals in Greece, so I think there is a great deal of experience she can share with us tonight. I'm very glad because we're just talking about it earlier today. Some professions, finding meaning and expression as a person is something you do in a way that the final users of what you do, they cannot see who you are, but this doesn't make it any less meaningful. And I think talking about pharmaceutical and the process of development and the clinical research is a very important aspect for that. So I'm really looking forward to hearing about this part. Evidently, I'm very, very glad because Eleftheria is a graduate of our MBA program, which makes it even more interesting and exciting for me. And that's the really important part. I think she's very modest. You're going to discover this in a minute. I think she has taken the initiative to do something in the period of that Greece was getting into the crisis that has made her group operate in a way, in a very cutting-edge way, in a world-class way, from Athens, offering something to the company and to the world. So thank you so much for being with us. I can really understand what it means to be here today after having a bad flight from Amsterdam.
Yes.
But that's the start of the year. So welcome, Eleftheria. Floor is yours.
Thank you, everyone, for having me here. And thank you, Professor Mainemelis and ALBA, because it is a great honor to speak with you while a year ago I was sitting there and trying to find inspiration from people that were sharing their stories, their experiences. So I am very, very humbled and honored for being here. What I would like to share with you is actually a little story. It's not about myself. It's about what we do. It's about my job. And it's about what I have found as an interesting way to make my life more exciting and make it worthwhile. Because for some of us, and maybe for all of us, working is in the everyday life is something very important, and sometimes we don't give it the value that we should in terms of our professional careers. And what I have learned from ALBA is that our profession is something that matters, and to what we do and our inspiration is something that matters. So maybe I am not a genius delinquent, as the people that you spoke about before, but I think that every one of us has the right to have their own inspirations, their own dreams, their own goals, and to find ways to make it work. It's very important for me that we have this conversation because my story evolved in the midst of crisis. So it was a kind of a bet that was taken, and it was actually delivered successfully. So before I start saying my story, I would like to ask how many of you might be aware of how a drug comes to your pharmacist and into your bed table? Like, do you have any idea about research? And I know there's one person that knows very well, but do you know, for example, what a person in clinical research would do? Any of you? No? You don't. So it was my mistake that I didn't bring a depon with me. A depon is, you know, the thing you usually have when you have a pane, any kind of pane. And inside you can find a really long and folded piece of paper which has many information. And the information in that paper comes from something called clinical research. So even the smallest thing that you buy from the pharmacist or is prescribed from a doctor means it has gone through the process that we will be talking about. Overall, I would like to give you just some information about me. So I am leading the clinical operations team of Novo Nordisk. Novo Nordisk is a Danish pharmaceutical company. It has a very long history, 90 years history of fighting against diabetes, and now it's operating also in other areas. And here in Greece, they have been operating since 1980 something. And we started a new division, a new clinical research department in 2009. The story of my life a little bit. I have worked as a clinical research associate and as a monitor for Regulon, which was a biotech company that never took off really. So it was a nice experience, but a bad experience. I have been a clinical monitor for Bristol Myers Squibb, which is a company that specializes in oncology. I have been a project manager for a small Greek company who is specializing in clinical research, but it's not a pharmaceutical company. And then I took on the job in Novo Nordisk, Greece, as a project manager and local trial manager. And on these 7 years, we developed a 12 people's team, let's say, which is now the clinical operations. Before that, I studied at Northeastern University in Boston, Massachusetts, and I have worked for a biotech company in Cambridge, which was a very nice experience because at that time, when I was studying in 1993, it was the beginning of the biotech blooming era, which has now been very much established in Cambridge. And now that I went some years later, it's an extraordinary situation. Before speaking about what's going in Novo Nordisk, Greece, I would like to tell you that my decision on going into clinical research began when I realized that there is a stepwise process to go from having a research molecule, something that you find in your lab, and then taking it to becoming a drug. So I said, oh, very nice. I don't want to be in a lab on my white coat and deciding what's the eye of the Drosophila, which is a fly, but I find better interest to see this process. And this was a decision that I made early in my career. And so it was a little surprising, of course, that I did that coming back to Greece. The reason I came back to Greece was because in 1999, things looked good. So actually, it was not so bad. And I thought, well, why not going into a place where things should be happening? Because in any case, I was Greek. I studied in Greece in my first years. So then coming back and, finding this European country was something exciting. And that was it. But, of course, crisis came. And I was a little bit, trying to figure out, should I do something else? Should I pack my things and beg for another job somewhere else? But that was not the case. That was something more of a fear that I had and not what really happened. Because opportunities do come. And I have two cases where opportunities came at the time that I didn't expect it. For example, I got my job in Bristol when it was summer. It was July. And everyone was telling me that, you know what, you're not going to get hired because nobody hires in July. Well, I got hired in July, had 1 month of vacation, and in September, I had my job there. So what I mean is that you cannot, decide on something if you don't try it. The second part was my job at Novo Nordisk. When I decided to go to Novo Nordisk, I was then working for a small CRO company. Companies are companies that actually are providers of clinical research, but they don't own the product. So what they do is they come to the pharmaceutical, they say, you know what, I put the people, and you give us the what you want to investigate. We'll run it in the Greek market, and then we'll give you the results, and you pay us. Well, those companies have some problems. Most of them is that the loyalty is different because the product is not theirs. So you have a lot of people doing different projects, but there's no so much ownership. And ownership for some people, depending on what's your character, for example, means a lot. And to me, loyalty and ownership means a lot. So when I found this ad from Novo Nordisk, it was not a very high-end job then. I said, you know what, I'll try it. And I wanted to try it because there was no such department. So they were creating a new department. And I thought, what a great idea. Why don't I just go there and, bring my crazy ideas there? The reason my ideas were crazy was that I really believed that we could do it. I really had faith to the Greek investigators who are the physicians. I had very good relationships with them. And I was not, taken by that negativism that was around it. So I was not really saying, oh, you know what, we can do it, and who is going to do clinical research in Greece? And I think that that's the craziness that was positive about the way I looked at things at that point. So, going to Novo Nordisk, I am very happy because this is a company, which is a biotech company, that has been using clinical research as a way of creating value, which means that it doesn't acquire research from other companies. It actually creates the value of its products by having people inside the company to do clinical research. So at this point, we have clinical sites. We have 2,500 clinical sites, which means centers around the world. Some of those, around 20, are from Greece. We have been providing half of the world's insulin, but now slowly moving into obesity and to other areas of interest. And this is something also eye-opening and very interesting. And what is important is that R&D is not, in very closed areas where everything is, very, let's say, it's not only in the US and it's not only in the known European countries. The company decided that they can invest also in other affiliates that are willing to take the challenge. And this is something that I would like to advise everyone that might decide to do something different, that you have to state who you are. You have to state what you want to do. Because nobody actually will trust someone who's indecisive. Should I do it or should I not? Am I going to have some problems? Yeah, and then what happens if I have problems? Well, yes, you're always going to have problems, but the thing is that someone who trusts you wants to know that you're going to try to solve them. So if you go into a situation, my advice is, go for it. There's nothing to lose, especially if what you're creating is not there. So you're not going to lose anything. You're creating from scratch. We have what we call CMR regions. CMR regions are large clinical, medical, and regulatory clusters. And the different countries, the different clinical departments belong not only to the country, but only to the cluster that is responsible for creating the data. The data is the information that will then go into the spec sheet that you use when that you see when you use drugs. So, at this point, what we do is, as I said, clinical research. We don't do the primary research, which means to create the molecules or to identify molecules that will be later used in creating the product. But what we do is we take phase 2 to phase 4 studies that actually are used, the data is used to receive approvals for this, for those compounds in the markets. Just for you to see the journey.
The journey from an invention to patients is a long one. It takes many years before you actually enter clinical trials. And the clinical trials are there to establish that it's safe and that it's effective. Now, so there are different stages in clinical trials. The first stage is that you try and establish that dose, how much you give, how often. Do you give this medicine once a day or twice a day? Why is it that some medicines are difficult to take? Well, it's because we can't change the properties of these molecules. So we have to find that out in phase 0, we used to call it. Then we move into testing this in human beings. And the first phase is actually doing that in young men. And it's not that we are discriminatory in any way, but it's felt that it's better to give it to young men because you never know if a young woman is pregnant and you don't want to take any risks. Then once you've established that it's safe to continue, then you start giving it to patients. And that's when you enter phase 2 of the clinical trials. You probably take patients that are very ill or they've tried many other drugs before that didn't work. And you also try different doses. These phase 2 trials are sophisticated. They require high-tech investments. It's only the best university hospitals in the world that can do this. This is an area where Europe is very good in competing, by the way. Once you've left phase 2, you go into the phase 3, which is the big investment, both in terms of time and in terms of money, because that's when you test whether this works in a much bigger population. Phase 3 trials could have thousands of patients. So in order to get, for instance, 10,000 patients, you may have to include both the US and Europe and Asia in the trial. You have to have a standardized testing regime. We call it the protocol. This is a test plan that has to be implemented everywhere. Everyone has to be prepared. Everyone has to have the right equipment. I think you can understand that this is quite a significant project that you undertake. So after this phase 3 trial I mentioned, you will get your approval from the regulatory authorities. Here in Europe, it's the European Medicines Agency in London. But after that, we do follow-up studies. We call them phase 4. And sometimes these studies are there to find new uses in new patient groups, in new combinations with other medicines. The timelines for development therefore vary significantly between maybe 5 years for your clinical development, for all the trials I mentioned, up to 8 or even 10 years. And once we're finished with these studies, we usually take almost 1 year just to look at the results and summarize the results and put together in the study report, which is the end product of clinical development. It's a clinical study report which runs over binders and binders. And there are tons of data in there, and we all submit this to the regulatory authorities for approval. And later on also to medical journals for writing up a more popularized summary for the benefit of everyone. That's the very long journey of clinical development and clinical trials.
So I hope this was a little bit informatory of what is happening. So we have been assessing the value. What is the value that clinical research is bringing? So, for example, for our purposes, for Novo Nordisk, we know best, or what we know best is insulin. So we know that in 2035, 592 million people will be affected by diabetes. And what we do is we try to find not only the medicine that will work, as does Eli Lilly, but also what is the best way to help people to prevent the disease, and also how to live a healthy lifestyle. So what Novo tries to do is not only tries to do clinical research in the cities, in the areas that is operating, but also try to find what are other things that can bring value to the community. At this point, the commitment of the global R&D is on 9.9 million US dollars in the period of 2012 until 2016. So in Greece, we had 5.6 million. Well, that's nothing, right? But if you think about it, when we started in 2009, it was not even a million. It was probably 300. And this is excluding the people that are actually working in the company for this. The 5.6 million is something that has accumulated in the last 3-4 years. So what we expect is that in the next years, this is going to increase dramatically. And someone might be thinking, where is this invested in? Because this is not money going around, but money invested. So it's not what is being paid to the local companies, not money that is circulating, is what the R&D has brought in the Greek market. So what we usually do is we pay the facilities for using them. We pay the hospitals for using the facilities, the investigators. We create, if we run a clinical research study in a hospital, then we bring the equipment, and we bring knowledge, because all the investigators are being, trained. They are being probably transferred into other units where they learn more things, and all of that is, the 5.6 million is only a fraction of what is added into our community. I don't want to get into clinical research more, because maybe there are many details. But what I would like to pinpoint is that it's very hard for the Greek mind to consider why being in a clinical research can be good, and the big pharma is not just trying to steal your livelihood and make you a guinea pig. So this is something that has to do with how far we are as a society into thinking out of the box. And sometimes it's very interesting how some of the physicians, some of the investigators are actually people that can think outside the box, although you might have a minister that can accuse you of any crazy thing that you can imagine. So they take a chance. Why they take a chance? Because they have to negotiate with the authorities, with their hospital, about the value of what they do. And this is something that we do hand in hand, because in the world there are rules. And it's very interesting how the Greek investigators follow the rules, and they can follow the rules, and the patients can follow the rules, and they can find something really valuable in being part of clinical research. Of course, this is a fraction of the population, but again, I think that it's very interesting, and it's an eye-opener for me, because usually we put things into, we tend to put things together and say, no, this cannot be done, and the pharma does that, and who's going to follow a protocol? But this is happening, and it's happening with good quality. So what I believe is very interesting for me, and it's been a very good step, is that I decided to be in an area, in a environment where things are not easy, but when things are happening and make me really happy. Why is it important so for us to do clinical research? First of all, we advance the treatment. Nobody would have the treatments we have if nobody did research. And we have to understand that. And it's good if you're part of the game and not just be outside of the game. We support development at sites. What it means is that if you train one doctor about something new, this doctor can use it also for his daily work. It's not something that stays only in clinical research. The other thing is that when you have clinical trials, then you have relationships. You create relationship not only with your team in the pharmaceutical company, but between different teams in the world. So our investigators meet with other investigators, and they have an opinion of what is happening. So what we think creates value is that we have improved patient care, we have better capabilities at hospital and clinics, we have scientific progress, and it has a good impact to the surrounding community, because the economy is actually affected in different ways. It's affected because you do something that creates value. The value, it's not only for a pharmaceutical company, it's also for the surrounding environment. And I know that in your classes, you'll also be able to, to discuss about what creates value and how you can take advantage of that. So I want to stop here and not, bore you with the rest of the details on clinical research. And I want to pick up on the points that were very significant for me when I joined ALBA. I joined ALBA in 2014. And the reason I came was because I was moving from what was the technical part, how to do research, to what in the world am I doing now that I have a team and I have a budget? And how can I take things into the next step? So I had to find someone who is actually a specialist and let me understand how you work with people, how you read business, and try to find the common language between me and my managers. Because, okay, to bring something new, to have a small clinical research division was nice, but then I had to answer questions for which I had an intuitive answer, like how much does this cost, and what would be the effect on our operations. But then I didn't know how to make the numbers work, and I didn't know if what I would predict would be, would have any value for the business. So I came into in ALBA, and what I realized that every class I took, it had a relevance to my everyday work. So I don't know how many of you have decided to come into ALBA for that reason. Maybe you have another reason. For me, it was a lifesaver because I could understand what they were asking me. And I could understand what I had to look at before I answer and how I should organize myself. Because at the end of the day, we all do business. So when you are in a big pharmaceutical, or you are in even in your life, you have to figure out what the energy or money you have, how you're going to use it, which will be your relationships that you value the most and why you value them the most, and then find a way to communicate this. I think that I became a wiser person, a more relaxed person, because it didn't frighten me anymore. And I hope that you find the same values coming into ALBA and finding people that can answer to some of your thoughts, some of your fears, and make you feel more comfortable to what your next step will be. So since then, I have to say that I think that I've been riding like a surfer. I've said that before. I ride the wave, which means that at some point you might find a very good situation. And if you are ready, then you go. And this is what I have to say to all of you. Be ready, have your board ready. When the wave comes, just do it. Because there's no guarantees for anything. You might fail. I failed 1,000 times, and I might fail next year. But it's okay. The thing is that for what I do now, I think that I do it in a way that I consider to be the right way, and I also consider that I'm taking back a good investment for my time and energy. I think this is also a good investment for you coming to ALBA and doing your own good thing. So I don't know if I have covered some of the things that I wanted to share with you. And I don't know if it's interesting, actually, because I'm excited, but I don't know about you. That's that.
I was really interested in listening to you talking about transition after transition after transition. There's a transition from a technical role to a managerial role, from one company to the other company, from big company to small company, from small company to large company, from one role to another role, from one country to the other country, from a stable country to crisis. Now, that's perfect experiential context for someone to answer the question, what have you learned about managing these career transitions? That's a lot to do, right?
Yeah. How you manage the transition, you mean how you decide to do the transition or how you manage afterwards? Because it's a different story.
Both. Anything, because I think that would be really interesting for us to actually we start our journey together talking about the very first class about managing transitions. And that was just really interesting. What have you learned about it? What advice would you give to other folks?
First of all, I would say that you have to embrace change. If you were to do the same thing since you were 20, you'll die from boredom. So you have to change. And it's a good thing, and you should decide. I believe that you should be at a point that you decide when you do the change, and you don't, let it make you, when you have to do it, then you become tired. It's good that you decide when you are in a good place that then, okay, now I want to make my change. And I think it's not bad, but you should find it within you. I don't think there are any signs. No, I don't think there are any external signs. One of the most important things is I always thought of change when I said to myself, I'm bored. It's not good to be bored. And so any of you might decide a different thing. For example, you might decide that you have a different trigger point. My trigger point was that inside me I thought that, okay, now I did that, okay, fine, but okay, let's go.
Okay. Well, if you allow me, I'm going to add something that I think could be really interesting to all of us here tonight. Eleftheria would be the very, very top 4 or 5 people I've met in my career as a professor in terms of learning orientation. which was all too obvious from the first time I met you. Very, very high in learning orientation, sort of, I'm here to learn, which I think is great. And I really think it seems to me it pays off, right? But you don't have to answer that, but it's a very important thing because I really think that's my recollection also of you, very, very high on learning. I'm here fundamentally to learn, to get things. And I really think that's a very, very smart thing to do, at least in this context of using this transition.
I want to add something more. When you do the transition, don't ever go back, ever.
No
Ever.
regression.
No. Like I did some stupid changes. You know, I could have been in another country. I never thought why I'm not there. Never, because when I go back to the day that I decided that I'm coming to Greece, I have the same feeling. I felt good. I said, you know, I'm going to do it. So going back to that feeling, it's a safe harbor. So don't go back and start saying, oh, how stupid I was. No, you were not. You made a judgment there. You have to trust yourself.
I feel exactly the same way. Let me go back to, you used the phrase, bringing my crazy ideas, right? Now, we're talking about it before. Working in a big company, an old company, a large company, an established multinational company, and by the way, a company in the pharmaceutical industry, where rules and norms are extremely important. Many of them are even parts of the law. How do you do that? How do you go about doing that? I guess some of the moving and doing things is not easy, right? So any insights would you like to share with us? I mean, you started up literally a new group here. So how do you go about doing that?
Yeah, you know what? I think that, okay, I don't know how to explain this, but the world is sometimes more open and better than a small group of people. What it means is that when I first went to Novo Nordisk, there was a group of people that were more negative than that what was actually out there, because they didn't know. And they were like, what are you going to do? And why do you need this? And then when we started collaborating with other countries, and this is a good thing, to collaborate so you can show people that, you know, it's not me, it's not my idea. This exists. Look at it. Then they start believing in you. So sometimes resistance does not come from the world. The resistance comes from someone who's very close to you. And you have to find a common ground of discussing. But I want also to advise, if you believe in something, don't step back. Let them go to another company. That's what happened to me. The people that were more resistant, they ended up not, you know, understanding. But at the end, I survived. Not because I took their job. You know what I mean? Mm-hmm. Is that we were in the same general group. My team bloomed, and theirs didn't. And what I want to say is that sometimes you need to be polite in the way you do things, but you have to be strong. Don't move. Sometimes your opinion is where you stand, not what you do. Is when you don't go back. You're standing there.
Okay. I was taken also by your comment of the way I interpreted that, of not hiding, of not concealing yourself, of just letting know people who you are, what is that you want to do. Is this something you would think it pays off in terms of starting new things? I think it was I found a very insightful comment. If you want people to buy into your idea, you're going to say to them, let's do that. The way I understood that is that people may be less likely to say yes unless they have a very clear sense also of who you are and what you own.
Yes, this is something that I find also with my colleagues. Sometimes when I work with some people, they're not very clear on what they want to do. And this makes me uncomfortable because I don't know what to expect. And I think it's the same for me. So when and maybe it's walk into someone else's shoes, if I come and say, you know what, can I propose this for you? And then you tell me, so what do you think? How much do you support it? Give me your insights. Tell me exactly what you want to do. And I am not clear. I mean, I don't trust myself. What would you? So I think that you have to stand. You have to have a point. And, you know, make it clear, because otherwise it's very hard for someone to buy into something that it's not clear.
I have more questions about the business side of it, but I'll keep them for a moment to see if the group would like to, someone would like to ask more personal question. Let's open it up to your questions, please.
If the clinical trials are in Greece or Amsterdam, and if you work in Greece or Amsterdam?
It was, you know, I work in Greece. Our investigators are in Greece. The joke about Amsterdam was that we have an European team, and we had a meeting in Amsterdam yesterday. But I don't know if you heard about the accident. There was a huge accident because the winds were 10 before you say it. Yeah, and so there was a big accident there, and the planes would not take off, and I came at 2 o'clock yesterday. No, this morning. But to this point, what I found in Novo Nordisk that I don't find in Bristol Myers Squibb is that they are open. The hierarchy there is different, is more flat. So the departments, like I talk with the German department, I talk with the Italian department, with different departments, and we meet. And I had a meeting where we have some problems here now on how we're going to do some things about quality. And there were people happy to tell me their experience. This does not happen everywhere. You know, sometimes people are very closed, and you don't know if you can speak with someone who is very high, and you have to take the permission of your boss to go to the restroom, and that's nonsense. So this is why it's very good. It's a very good environment, and when you are bosses, I hope that you let your people grow like that.
Yeah, let me just build upon Stamatis' question, which is a very good question. This is the second question, Stamatis. Tell us a little bit, because it's not that you manage 12 people, right? Mm-hmm. You also have to manage a whole network of relationship with hospitals, university mm-hmm. hospitals. Because it's also a question of managing outside the 12-member team. Give us a little bit of a sense of what this involves.
Yes. What we do is we try to separate clinical research from sales. Because in the eyes of the law we cannot interact. So basically what we do is we try to facilitate this by actually keeping things separately. So we run also the relationships with the investigators, which are the doctors, the relationship with the local departments, because we run clinical products research that are for products that are used for in the whole world. So sometimes you might have a conflict. For example, maybe the local company has, to lay off people in sales, and then you have like a big R&D department that does research. So sometimes there is some massage that you have to do to explain things. I think that another part is quality, is that you have the authorities that can come and inspect you. So you have to be very clear and very, in line with what is happening, and you have to know, you have to have the knowledge and pass it on, and to convince other people. So I think that most of our job is about negotiating, and it's the good negotiating, I have to say that I learned in ALBA, that when you negotiate to find a common ground and make things happen. You don't negotiate because you plan to take the money from someone, or to fool someone into something, but you negotiate into building something.
And I guess that's another transition you have to do, perhaps, I don't know if it is on a daily basis. You have to lead your team, you have to speak to your colleagues in other parts of the world, you have to deal with the doctors, different hospitals in Athens, in Thessaloniki, in Lysander.
Crazy. Yeah,
and you have to deal also with the Greek bureaucracy.
It's true.
Which one among these things is the most difficult to do?
None.
No?
I think the most difficult is my team. Yeah. Because And I think that was one of the hardest things I ever had, that I had a good team and it kind of like dissolved. And because I was very romantic, I thought we'll be together forever, but we're not. Because when you work in places like ours, you invest in people. You invest in their training, you invest in the way they make you trust them, and you know that something will be done. So when these people leave, then you have to start again. You have to start again the process of who do you trust and how do you do it. And sometimes, projects run, so you don't have enough time to do it. And I think that was the most stressful period of my life. And also because, you miss people. I don't agree with what they say that people are replaceable. Everyone is so different, and everyone, maybe you replace them in an operational thing, that you do the same work, but it's not going to be done in the same way. And as a person, as a manager, I think that everyone has their own thing.
Do you ever get a bit protective of your team?
Yeah, I think so.
It feels so.
Actually, I have to be honest with you, someone left from another department, and she said to her manager, if it was Eleftheria, she would have stood up for me, but you didn't. And I thought that was really bad.
Creates trouble for you, for sure.
Yeah.
Okay, let's get another question, please.
Hi. So I would like to ask, you told us about your transitions from one company to another and from one country to another. You also said that it's important being loyal, and my question is, how do you combine this in the end? Is it being loyal to oneself as he evolves through the years? That's the question.
Loyalty has to do with many things. First of all, to who you are. And then, if you decide to make a change, it does not mean you are unloyal. It means that at that point, what you have decided to do as a person might be different from what the company has to offer you. But I never left a job wanted to harm the company that I left. I was, and going back even to the people that I worked for, I can tell you that I am really grateful that I met them, and I can say that I'm happy that I met them. So loyalty has to do with a balance again, and the balance is that when you're there, you're loyal. You're not, for example, you're loyal at your work. I never said that I'll leave a project in the middle of it. Or maybe if I decided to make a transition, I'll inform my manager and say, you know what, that's what I want to do. How do you plan on doing, change my position? And what I learned also from ALBA and what I learned from my company is that there's always a plan for succession. So all the big companies have a succession plan. So what they say is that it's normal that you change and you go somewhere else. Loyalty lies on the way you handle things, not necessarily that you have to tie yourself to the company. I think it's the same for anything that you do. Maybe, it's also for the country. I mean, I love my country, and the States were nice, but again, I don't have anything against them. I don't have anything against me. So that's what I mean, loyalty. What I don't like is double words. I think it's a loss of energy.
We'll come to that side of the room in a moment.
So you said that when you came to this company, you brought your crazy ideas. So how do you handle with the crazy ideas of your team? And is it like you're utilizing these ideas, or because now you're evolving and you're on a setup and you have to prove yourself, you have to put them a little bit down because it's time to prove yourself and to prove your crazy ideas?
Yeah, you're right. If someone has crazy ideas, I know I can trust them because when they go home, when they eat, when they take a shower, they think of the job. So, and this is a little funny. So I trust the people with crazy ideas more than the people with no ideas about the job. That's one. Because I know they toponane, you know, they think about it. I let them do. Usually I let them do, but I think that my weak side is that I am very worried sometimes, and I stress too much, and maybe I stress them too. So I let them go with something, but then I'll be like, yeah, but did it work, did it not work, and so are you sure you did it well? So I think that I overdo it there. I agree. I think that's something I have to work on. But
my name is Konstantinos. Are you creative? In what way? And how you manage creativity in your group?
You ask me if I am creative. I think I am. But, you know, we don't have a lot of creative grounds to be creative, let's say. But the reason for this, and I think many of the people who work in big pharma will know, is that there are many rules. So we cannot really go out, and even now I'm thinking like, what are the things that I can say? You know, I'm a little. So we cannot be very creative in that way. But I think that we had some good ideas, and we actually materialized them. For example, we wanted to show how clinical research is done in Greece, and we created a movie, a small film. And we took it to our colleagues outside Greece, and it was really, you know, taken in a good way. We try to be creative in the very small, you know, world that we can. I don't know exactly what we call, how to define creativity. Because sometimes creativity is to be able to work and find uses in very small tools that you have. It's not that you will create something fantastic. It's not something that the whole world will know. Sometimes creativity is what you do with a pair of matches. I think that it's a creative work, but not as creative as others, which, you know, if you are a person that has, you know, is more visual, has, you know, fantastic ideas about other things, maybe you should try it and come into clinical research and see what you might bring, but I can't guarantee anything. So, thank you too.
Do you have any examples of jobs through your career path that killed your creativity that you could share with us?
Yeah, well, all of them. Okay. Yeah, it's true, because what I realized is that from, you know, being in high school and until, you know, coming now, you know, being an older lady, you have to negotiate with yourself of what you have to give up. Because when you're younger, you know, I wanted to become, actually, I was watching, you know, movies and things, and I wanted to become a DA in the States. I wanted to become a lawyer, so I didn't. I wanted to, you know, do specific things, and I didn't. So every time you go in your field and see what's there for you, and then you start working. And the good thing about becoming older is that now you have the confidence a little bit of knowing things better, and knowing how you can, you know, do your job, and then have a small piece in the day that you will do something better, that you will do something creative. For me, you know, coming here is a very creative thing. I have the opportunity of doing this, and so becoming older has some good things. But in many steps of my, my life, I had to give up something for comfort, to become secure. Because it's not easy to take grand steps every day. You don't take great risks every day. You take them at specific times that you feel that you should. And I don't think that living recklessly is also, innovative. Or if you do live recklessly, then you have to know what will be what you might face, you pay a price. So at every point of your life, you have to consider what you give up. And creativity is something that I gave up a lot.
And this is a wonderful answer in terms of the thinking process. If I may observe, the first part of the answer is I'm not as creative because of many rules and limitations, and intended by saying that having no limitations and being reckless is not creative either, right?
No.
So it's a very interesting way of negotiating.
It's a good example for the rest,
yeah.
Because I wanted to say something that I forgot. Observe. I think that one of the best things is that you can see, many lives by watching your colleagues and what they do and what they do good, and without judging, say they do this and they did this good and this was so. Basically, stealing things, not material things, but I mean stealing ideas, but not, of course, the ideas that you shouldn't steal. You know what I mean? Don't bring them as your own. Don't say it's my idea when it was not. But if you can, look at someone's life and get something from them, I think it's excellent. And I always did that. I like people's stories.
They have not seen the film with the stealing ideas. It's next week. So literally, it's not stealing.
Yes, it's being inspired.
Actually, I have two questions for you. You said that I suppose that you have a technical background, correct? So you said that you made the transition from being a poor technical position to in a managerial role. And now, as you are as a manager, how you differentiate yourself from your technical background? This is my first question. How easy is it for you not to jump to your technical expertise? Since I suppose that you have members in your team that they are experts on the technical, or maybe more experts than you.
Yeah.
Than you used to be, actually.
Big problem, yes. It's something that it's like someone who's dying and doesn't want to die. Like I don't want to let go. I always think that I do things better. But that's something I struggle with. So it's not easy. It's very easy for me when something goes wrong to know why, because my way of thinking is kind of like going forward. You should have done this, that. So it's very hard for me to keep quiet and not say anything, and try to do coaching, because we learn how to do coaching and mentoring, which are very nice ideas. That's very hard to do. So basically, that's my struggle now. Yeah, it's hard because it's not that being a manager is nice, not because you manage people, but because you have in your hands the direction of the department. That's what I feel. I never wanted to be a people manager. I never thought that I wanted to have someone under me, which is something I heard from other people. I don't care. What I care is that I'm like super excited that I have a budget, and the budget is good, and I can do things, and the group can grow, and I'm super excited about that. So for me, it's very hard to stand back and say that I will not be involved in little things. And of course, this is something that I should work on. That's the thing that I should learn now. It is.
And my second question is, now as you are manager and you lead a diverse team in across countries or different functions. What does annoys you on that, and what do you love it on that?
There are days that everything annoys me because I think that the pace is too fast. What I mean is that the information that comes is too fast. For example, we get a project and I see that my team works with a certain speed, and I lost someone who was very expert because he got a better job. I'm happy because he was with me 7 years, and he got a really good job, and he got a better pay, and he should thank me, and it's good. But on those days, I cannot do my work. And I know that there are other teams that are faster than I am, and there's a big headache there. That, what are you doing? Are you going to make it? Are you not going to make it? So sometimes I think that that's what kills your happiness. But at the same time, that's why you're there, to resolve problems. And then when things are resolved, then you feel extra happy. So I think that we're people, there are times that things go wrong and something can be really annoying, and even the littlest thing can annoy you. And there are some times that you can be really, I am impressed of how patient I can be when, all hell breaks loose. But everything goes down to relations. So if the relations in the department is not good, doesn't matter. You can't fix anything. If we all have a good day and we are, collaborating, I think things are resolved. I don't like party poopers. I don't like people that come in the team to spoil it. Like I can't stand it.
It's a little personal. I said, throughout your transition, how have you managed work-life balance and your family? And then secondly, what has been the biggest challenge that you have had so far?
Yeah. Okay, I agree with the word balance. But I think that everyone has a different balance. What it means is that some people want to have a family, and the family for them is children, for example, is their mother or fathers. I know some 30 years old in Greece that, still like to be very close to their parents, for example. I was not like that. It was not my character. So what I want to say is that, yes, you have to find your personal balance, but you don't have to be driven by what is defined as balance for others. You have to decide what's your balance. So, for example, I realized that work for me is more important than something else, because that's the way I am. I don't have to blame myself for that. Also, I have I like different things. For example, I have other philosophical, questions in my head that maybe not everyone has, but we don't all have to fit in certain groups. But I would advise someone younger to pay attention to who they relate to. It's very important to be happy, because not all of us fit with everyone. We can be very open-minded in our workplace, but when we are at home, find the people that express the same thing and make you feel comfortable and safe. Not all of us fit the same model. And I think that if I didn't do the things I do, I would be really unhappy. So I don't know what to say.
Let me just build up on that. When you go to watch a movie, has it ever happened to you? You're watching the movie and then you miss out 10 minutes of it because you are thinking something that happened at work? Or you can say, no, I can completely take a distance between the work and...
Yes. Actually, it's really funny. I can watch a movie and watch a scene that is related to my work and say, what in the world, I could have used that and I didn't think about it. And that's what happened to me in ALBA. And I'm afraid that, you know, I can't remember everything. So I think to myself, you know, where are you going to get inspiration for things now, you know? I should go to the movies, I'm not sure. Start something else. The biggest challenge, okay, change is a challenge. Yes, yes. So every time I change something, I had a really hard time. Emotionally, and you know, I didn't know what to trust, how to go, and then I said, oh, you're stupid, how are you doing it, and da-da-da-da. But I always had something safe in my mind. So I think that everyone has a harbor in their mind. I don't know what's, could be your parents, could be a place that you like, it could be yourself, it could be a decision, yeah. But I think that all of us have a harbor, and at hard times, you kind of like go back, yeah. You know, trust life is not so difficult, I think. That's my opinion.
Do we have another question? Okay, I'll ask a question. Oh, we have one. Yeah, please.
And one more thing, it's not that I have not been rejected. So you have to decide about standing and who you are.
I think she understands you very well,
yeah.
although it's never meant to be.
Yeah.
I'm Nikos, hello.
Yes.
Do you ever feel challenged by your team, and how do you deal with that?
Yeah, you know what? I have to say, yes, I have been challenged by my team more than I have been challenged by my bosses. And why? Because when you are a team leader, let's not say a manager, when you're a team leader, you have more obligation towards the people you lead than you actually have towards your boss. And I think it's normal, but at the same time, it took me by surprise that actually it does happen. You have a lot of responsibility, and you will be challenged. Also because you stand between two forces. Being a middle manager, I think, is more difficult than being a general manager, because a general manager is a general manager. You know, he manages a big team. He has his middle managers, and it's good. When you're a middle manager, you're between a group of people that you know work hard, and then a lot of things that happen above them that they don't know. And sometimes you have to translate things. And that translation is what makes you who you are as a manager. What I mean is that, do you take the heat from the top when things are bad? Do you take the heat from bottom where things are bad? And how do you translate them? So you won't have like a team that is, you know, feels that is being completely exploited by the company. And also the company that sees people that are actually working hard and gives them chances, you know, gives them opportunities. So you're very important at that role, and I think it's normal that you're being challenged. Your responsibility is big.
Eleftheria, there's something I want to ask you, because I think it's a great learning point for us. We've discussed, in another class, we discussed different types of innovation, incremental and radical. So if I got it well, you work in a company that is a leader in diabetes, and you have treatments and therapies and drugs of diabetes. But part of the research that you're doing is to discover something that prevents completely diabetes. It's an interesting case for me. What we discuss sometimes just being shaping the future. Can you tell us a little bit about it? I found a very good example. It's a real learning point. Here's a company that makes drugs for diabetes, also making research, trying to make sure that diabetes doesn't occur.
Well, this is enrooted in the history of the company. So the founders, Novo Nordisk belongs to a foundation. It's not it's a company that has some special in some way. And one of the founders was actually the wife of the person who actually brought the knowledge about insulin in Europe had diabetes. What it means is that slowly all of us, we learn about the history and we know about the burden. And one of the things that surprised me at Novo Nordisk is that they try to find what are the things that put you at risk for type 2 diabetes. So, for example, and they pass it on. For example, in the offices, we don't have sugar. We might have sugar for someone who comes to visit, or we might bring some chocolate, but it's forbidden to have Coca-Cola and things like that. And we learn how to eat correctly. We campaign how to eat correctly. We campaign how to exercise. We have what we call take action also, because I think it's part of the company's DNA to educate people on how to lead a healthy life, and it starts with us. I think one of the good things that I took from Novo Nordisk is that I changed my lifestyle, and I think it's very important.
No birthday cakes.
They give us flowers.
Flowers sounds
when we
great.
Yeah, we can eat it. Well, when we have meetings, we have fruits, and we try to. You feel actually you can. People look down on you even if you smoke. It's a very healthy, aware, environment. But overall, I think that it makes sense to me that they work on a disease. Okay, they do want to make money. It's no question that they want to be able to sell to the people that are sick, right? Fine, but. They don't withhold on information that comes out of research and is related to how to prevent it. And we talk about it.
I think we have time for one last question. Let's hear Marius, please.
Sorry. Just out of curiosity, if you actually make the actual cause of the basic treatment you are offering in the world disappear, wouldn't that destroy a significant portion of your revenue or, let's say, market value?
Okay.
It would be a great thing for the population of the world that is actually sick.
I will tell you a story.
Sure.
Yeah. Some of you might know. Gilead is another company. Gilead probably. It's a company that has worked very much with the hepatitis. And the virus, the hepatitis that is, coming from a viral infection is very hard to eradicate. So Gilead discovered a drug that did that, and they cured it. Did they lose? No, they still exist. Why? Because companies, usually good companies, what they have, what is their value, is the knowledge of how, for example, to manipulate proteins. And you can find another protein, like in our case, that you will develop. So the value does not get lost. So if your knowledge and your value is not lost, then you'll find another place to develop. I think that if, for example, you don't find the way to treat diabetes, Eli Lilly will find it. Someone else will find it. So it's okay if you find it. But, as a company, you have also your exit strategy. What happens if you find it, And then you move on. It doesn't mean that you have to stick, as I said, change is good. You cannot stick to the same thing forever, and you cannot wait and say, I'm going to withhold things that are good because I want to make revenues. That's the way they think. And I think most companies that are, true to themselves, they know that and they work with that. That's what I learned.
All right. I would like to thank Eleftheria. I'll tell you, I got three things.
There's a question?
I think we have to. So three things that I really learned 3 hours. Reflection. I really appreciate, and I hope you appreciate the degree of reflection and experience. And some of your answers were very, very. They saw that you have spent so much time not only experiencing things, but also reflecting on what you have experienced. So, and I'm so glad that we have this in the video. So answers to like you become a manager, not to manage people, but to be able to influence where the company is going, what you do. And I really appreciate that. The second one is research. And some of us, we have a hard time in this country explaining why research is important, why research makes things better, why research makes a better school, why research would make a better society. And I really appreciate the facts of what you've been doing in your group, having research here in Greece, and also some of the insights you gave us about managing the politics of sometimes being able to do the ideas. And the last one is restraining. I mean, imagine working in a place that has no sugar, no alcohol, no tobacco. Sounds fun, doesn't it? Thank you so much. Thanks.
Thank you.